lower back pain, it can be connected to the breathing. If you don't tend to use your diaphragm, so the diaphragm is the big sort of umbrella shaped muscle that is here, sort of base of the ribs, and it goes all the way around to the spine at the back. So it's a sort of dome shape, and as we breathe in, it moves down, and as we breathe out, it comes back up again. So if this muscle, if you're not used to breathing down into your belly breathing, and you're sort of breathing mostly into your chest, then this muscle doesn't get used so much. And this can then create, well, the muscle isn't doing what it's supposed to be doing, which is moving and staying strong and healthy. And when a muscle's not doing what it's supposed to be, what it's made to be doing, then compensations in the body can occur. And that's sort of when pain happens, when other parts of the body have to work harder. So we can target the diaphragm using a 360-degree breathing technique. And what that is sort of imagining that your sort of trunk is like a barrel, and you want to breathe into the entirety of that barrel. So not just the front of the body, but the sides and the back as well. And I find it helpful to sort of think about breathing into the lower back and sort of down towards the pelvis. So we can do that by just sort of settling in for a moment. And just start by observing what your breath wants to do naturally, or what it naturally does. And then in your mind, sending your breath further down. So we want it to come down. We want the belly to expand, the sides of the body to expand, and the breath to expand into the back. So with every inhalation, just sort of imagining and sending that message from the brain into your body. So feeling the diaphragm moving down as you breathe in, and breathing out. Now, if you have a history of trauma, breathing this way might make you feel anxious. If that's the case, then stop doing it. There are other ways that this can be, you need to sort of come at it from a different angle. But if you're okay with this, then keep going. And what we're going to do is we're going to try and do an inhale for 5 seconds and an exhale for 5 seconds. So exhaling naturally in preparation, and then inhale. That's 3, 4, 5. Exhale. 2, 3, 4, 5. Inhale. 2, 3, 4, 5. Exhale. 2, 3, 4, 5. And continuing with this breath for up to 5 minutes if you can, longer if you feel comfortable doing that. And when you've done your rounds, just closing your eyes, letting your breath come back to a natural rhythm. And we'll finish there.